us today is Andrew Slater. Andrew, you're the CEO, is it?
Yes, I'm the Chief Executive Officer of Home Care Medical in the National Telehealth Service.
Right, okay. And you've come in today to talk about the National Telehealth Service, and that was something that you launched 1 year and 1 day ago.
Yeah, so the National Telehealth Service went live 1 year and 1 day ago today. So prior to that, there was about a 15-week period in which we built the service and built the organisation that delivers the service today.
And that's not a very long time, is it, to build something so large like that?
Absolutely not. So one of the key things for us was our ability to partner with the vendor community, with service users and the wider sector in order to be able to deliver a service on the 1st of November 2015. But we were delighted to have done that.
Okay. And then since you've delivered this service 1 year and 1 day ago, you had over, was it 550,000 New Zealanders be in contact with you?
Yeah, so we've had, up to about yesterday morning, we had 585,000 contacts from just over 425,000 New Zealanders. They're contacting us through phone, textbook, Facebook, web chat, email, fax machine. And so those contacts have been coming through every day since the 1st of November last year.
Right, so you've got quite a few avenues of how someone can get a hold of you.
Yeah, there's over 200 ways to access Home Care Medical. So we have, that's total email addresses, websites, phone numbers and things. So there's quite a few ways for people to come and access our clinical teams.
Oh, okay. So tell me how your service works. So how is it set up?
Yeah, so look, what the public sees is quite different to what actually happens behind the scenes. So if you're a member of the public, you'll be seeing things like adverts on television for the John Kirwan National Depression Initiative. You'll be seeing things, the Quitline phone number on the back of cigarette packets. You'll be seeing the Poison Centre phone number on the back of cleaning products, the gambling helpline number in places where people gamble, etc. But actually what's happening in the background is we've got 5 clinical teams that work 24 hours a day, 7 days a week on that technology. So they're providing great clinical advice, and that consumers come in either through text or through a phone number, through those brands and adverts they've seen, and then get connected with one of those clinicians.
Okay. So if someone rang up, do they go through like a 111 service or?
No, so for our service, it's all about making sure that we build as many doorways into the service as consumers need in an effort to be connected with care. So, for example, it's very rare unless you've called, for example, Healthline, and within that the nurse works out that perhaps you need to speak to a counsellor, that they'll then bring in a depression caller. But there's no pre-call screening that happens.
I see. Okay. One of your aims you have is to connect sort of points of access. Is that right? And you had some values that you mentioned as well during your talk.
Yeah, so Home Care Medical's ambition is to virtually support Kiwis to stay well and connect them seamlessly with care when they need it. And we're a social enterprise. We're owned by 2 sort of iconic NGOs in the primary healthcare space, Pegasus and ProCare.
Right.
And our core values are do the right thing, passion for better, motivated by quality, and pukehiwi ki pukehiwi, which is Māori for shoulder to shoulder. And for us, that describes how we want to work in the healthcare sector, side by side the existing providers providing services.
Okay. And so how does someone get in contact with you, like a person from out in the community, if they want to get a hold of you?
Yeah, so look, it depends on what are the services you're coming through, but if you take, for example, the gambling helpline, there's an 0800 number, there's a text message number for that, or there's a web chat box on the gambling helpline website. So you can use any of those pathways to get into our organisation and speak to an addiction specialist that will be able to help you with your gambling.
Okay. And so one of the things you talked about in your talk was you gave an example of Plunket. As a sort of platform. Can you talk more about that? Yeah,
so Plunket's one of our service delivery partners. So what happens with Plunket, so prior to Home Care Medical running the National Telehealth Service, what used to happen is if you'd called Plunket line and you had a sick child, they would transfer you through to a Healthline nurse. What we've been able to do with our relationship with Plunket is create an environment whereby if you're speaking to a Plunket nurse and you then start talking about a sick child issue, what will happen is they will open up our systems and the National Telehealth Service platform and provide that healthcare advice.
That sounds really good.
It is. Look, it's benefited about 30,000 parents this year haven't been transferred after building a rapport with one nurse to another nurse.
That sounds good. good service advice as well that you get. And so where to from here? So what is the sort of thoughts about the future?
Yeah, look, for us at Home Care Medical, so it's in the next year we're going to create another team of clinicians, which will be a crisis mental health nursing team.
Excellent.
And that team there will be working with the broader police, DHBs, ambulance services to develop a different response to people in mental health distress across New Zealand. What we're then also doing is we're building more websites, more web platforms. So in the coming weeks, we're about to go live with the new journal. So the journal is the John Kirwan Initiative. It's an e-therapy tool. There's about 7,500 people a month that use that tool. Right. And what we're doing at the moment is we're rebuilding that so it will work on all mobile phone devices.
That's good. Oh, well, thanks very much for coming along today and having a chat with us about your interesting platforms that you guys have been designing. I'm looking forward to seeing what comes forward with these future tools and things that you've got going on.
Brilliant, as are we. Thank you.
Yeah, cheers.